In order to address the harms discussed in Project 2, our first proposal is the national implementation of mobile farmers markets and delivery services from local food pantries, operating with the goal to improve access to fresh and nutritious food in rural communities burdened with nutrition-related health outcomes. Similar initiatives have proven effective in the past. A nonprofit organization called Produce on the Go, or POTG, introduced a mobile farmers market in a rural county in California. This service provided locally grown fruits and vegetables to individuals via weekly visits using a mobile grocery truck. This model is particularly relevant to the population we aim to help, as the county they studied exhibited high levels of rurality and unemployment and poverty. The study examined structural forces affecting food access, interviewed national level managers of similar mobile food operations, and incorporated feedback from local residents who utilized the service. Some strategies they included involved selecting convenient and high traffic locations, such as health clinics, schools, and common work areas. The mobile market also offered flexible hours, such as Monday mornings and Thursday evenings, to accommodate both clients and workers' conflicting schedules. This flexibility in location and time further enhances the effectiveness of this approach because mobile markets can be positioned in high traffic areas at peak times, such as outside schools, health clinics, or near workplaces. Another relevant example is The Works, another mobile grocery store based in Austin, Texas. This initiative offers a program called So Me Fresh Savings, where SNAP recipients receive an additional $20 in produce for every $20 they spend. This incentive promotes the purchase of more nutritious foods. The program was completely funded by private donors and operates in partnership with a local grocery store, showing it is possible to address these issues at a community level. Both models practice weekly visits to consistent locations, helping to create reliable access for community members. These services also generate business for local farmers and nonprofits while simultaneously serving surrounding populations. While mobile markets involve high costs up front, they typically have relatively low variable costs. That means that although substantial initial funding is required, operating costs decrease over time. Programs like these should aim to keep prices competitive with or lower than those at traditional grocery stores. Importantly, the markets would accept SNAP and EBT benefits, creating more equitable access to fresh food. Additionally, by supporting local agriculture and creating opportunities for farmers, the program could potentially strengthen the local food economy. However, there are several stakeholders burdened by this initiative. Staff, including drivers, cashiers, and loaders, will face logistical challenges in running mobile markets. Farmers may need to adjust production and distribution processes. Grocery stores, restaurants, and/or the nonprofits providing the food are also burdened financially. Administrative staff will be needed to manage communication, coordinate routes, and build community relationships to form and maintain these connections. Taxpayers may indirectly support the initiative through funding for nonprofits and USDA subsidies for agriculture. Finally, funding would be diverted from other uses within a nonprofit to fund these mobile markets.
So our second proposal is the Rural Food Access Program, which we've abbreviated to RFAP. This program would expand on the successful Healthy Food Financing Initiative with targeted rural solutions. Specifically, the RFAP would annually invest public funds matched significantly by private and philanthropic contributions into projects such as mobile markets, like we mentioned in the previous proposal, small community stores, and food hubs that connect local farmers with nearby consumers, as well as subsidized transportation or delivery pilots. Modeled after the HFFI and the California Freshworks Fund, the RFAP would incentivize rural grocery store operators with loan forgiveness after 5 years of sustained operation, give grants for energy efficient upgrades, and then create state-level rural food task forces whose goal is to help rural food projects get approved faster, such as speeding up permits or paperwork, and find more money from public or private sources to support the projects. The RFAP would help rural communities by providing practical solutions tailored to their unique challenges. Unlike supermarkets, which struggle to stay open in small, spread out communities due to their low profit margins, smaller markets, mobile grocery stores, and local food hubs have proven effective. Reiterating points from the previous proposal, A mobile market in Buffalo, New York successfully brought fresh produce directly to 1,500 residents, which demonstrates that smaller scale solutions can reliably meet diverse local needs. Similarly, the Stop and Shop in Lyman, Colorado, used a small loan to prevent closure, which preserved essential food access for the town and also reduced its energy costs through upgrades. Food hubs such as Hattie's in Akron, Ohio, showed that connecting local farms directly to consumers not only improves food access, but creates valuable local employment. The RFAP builds on these real-world successes by focusing on flexible, community-driven approaches that can actually sustain themselves economically in rural settings.
The extent of these additional burdens pale in comparison to the burdens placed on individuals living in rural areas without access to their choice of food that will best impact health and outcomes. The burdens placed on taxpayers in these proposals are justified through proactive prevention. Rural food deserts exacerbate health disparities, with obesity odds 30% higher in such areas. This costs over $400 billion annually in diet-related diseases, which taxpayers already bear indirectly.
Established in Project 2, without feasible, efficient, and desirable access to healthy foods, nutrition-related diseases will continue to grow in rural populations, which inhibits individuals' well-being, mental and physical health, as well as their ability to live to their full extent. Chronic diseases, which are exacerbated by unhealthy, processed, and limited food, include diabetes, hypertension, cancer, and cardiovascular diseases, all of which severely impact life expectancy. Simple interventions like those that we've mentioned provide sustainable measures to combat this growing health concern while also alleviating unjust and structural burdens from a vulnerable population.
From a contractualist standpoint, addressing the food insecurity crisis facing vulnerable rural residents makes our proposals an essential investment. Ensuring equitable access to nutritious foods for all Americans, regardless of where they live, is a moral imperative, making any temporary burdens a justified and necessary step towards healthier communities and a stronger economy.